Good afternoon. Today we're joined by Dr. Rachel Herlihy, our state's lead epidemiologist, to update you on the alarming trends we're seeing in Colorado and the need for action. Jill Ryan, Executive Director of CDPHE, which will go over what we call our DIAL framework. It's a localized framework to react to outbreaks in areas where they occur in a county by county basis, even drilling down beyond the county, working with local governments. We also have a very exciting announcement today from Kate Greenberg, our terrific Ag Commissioner, who's going to be talking about supporting Colorado's farmers and ranchers with an exciting new announcement. Our farmers and ranchers have been, like every Coloradan, really impacted by the economic situation and the food supply chain and distribution of food and consumption. And a lot of that is processing, a lot of that has climbed up the supply chain. Commissioner Greenberg has a very exciting announcement for our farmers and ranchers today. Before we get into those updates, I just want to address the concerning trend that we're experiencing in many states in our country, including Colorado. We are still seeing an increase in hospitalizations, and that has not changed yet. Today, 1,208 new cases, a 6.24% positivity rate. As a reminder, World Health Organization recommends keeping that below 5 to show you have enough testing to identify outbreaks. We also have 36 net new hospitalizations for COVID. We're now at 417 people currently hospitalized in our state for COVID. That's out of roughly 1,800 beds. We're going to drill into the hospital beds, the surge, how many can be filled, how many are filled next week in an extended update about hospital capacity. But right now, if you look at it, 417 out of 1,800 beds, that means about 1 out of every 4 hospital beds in Colorado is filled with a coronavirus patient. And when we toss out numbers like 1,800, and we'll talk about next week, there's a capacity above and beyond that 1,800. But when they toss out that number, that does not mean that there are 1,800 beds for coronavirus patients. There need to be enough beds for the normal workload of hospitals, meaning if somebody gets a heart attack, a stroke, has a operation to remove a tumor, any of those things that require hospitalizations, brain trauma, car accidents, all of those things need to have capacity. So when you hear 417 beds are full of coronavirus patients and you think, oh, there's 1,800 beds, that doesn't mean that all 1,800 can be ever for COVID patients, because we have many other things that affect people and that require life-saving interventions and hospitalizations and beds. Now, again, we'll talk next week about kind of that true outlook of how many beds there are, how many there can be, what's that surge capacity. I hope at that point, in a few days from now, we hope that it's less than 417 people hospitalized, but we fear that it could be more. And that has been the trend, and that's why we really need action to change that trend. We cannot go on as we have been. The status quo is not acceptable. We need to do a better job wearing masks around others, staying apart from others, reducing our social interactions, right? Keeping them to, if you're going to see one other household, 2 households recreating, right? Not a neighborhood get-together, not a picnic, not something with 5 or 6 households, preferably with your own household for the next week or 2 while it's the most dangerous. But if you need to socialize, one other household, right? The more of us make that decision in how we live over the next few weeks, the better we will do as a state. And I know that we are all very tired of the virus. Fatigue is setting in. That's why we're seeing these numbers increase. But the virus is not tired of us. It is still deadly. It currently has sent 417 Coloradans to the hospital. Many will make it out, and some will not. Some will not make it, and they will join the increasing casualties from this deadly worldwide pandemic that has disproportionately affected the United States of America because of our nation's lack of preparation and a national plan. We have one of the highest death rates and number of deaths per capita than any other country, and it's not over yet. That's not an area America wants to lead. We can do better. We will do better. And here in Colorado, we want to set that example of containing it early, work closely with Adams, Arapahoe, Denver County. I had calls with some of their commissioners today on the additional mitigation steps being taken in some of the areas with a higher level of community transmission. We just have this short window of time to get this back under control before the holiday season, and we need to do it. Every one of us needs to really ask ourselves, what is our resolve to avoid unnecessary loss of life? Could be your uncles or aunts, your sisters or brothers, could even be your own, but also avoid the economic setbacks that additional increases in the rate of transmission could cause here in our state. We now have over 2,060 Coloradans who have succumbed to COVID. And my condolences to the families, friends, loved ones of those who were directly affected, and a 417 currently struggle with hospitalization for coronavirus in our state. Before we get into the epidemiological and other updates, a brief update on the fires. Cameron Peak, the largest fire in the history of our state, 205,004 acres, now 51% contained. There are still mandatory evacuations in place. The focus is protecting the southeast corner around the fire spot, completing containment. Calwood Fire, 9,365 acres, 17% containment. There are still mandatory evacuations in place. Some residents have moved back. Check if you are among those. Left Hand Fire, 470 acres. We're seeing very active fire behavior there, only 4% contained. East Troublesome Fire, 15,546 acres, 10% contained. There was also mandatory evacuations in place. There's also a new fire that we, as of this morning, the ice fire in San Juan County near Silverton, 320 acres. There were several hikers, campers that were evacuated by helicopter during the initial response, and that fire is highly visible from Highway 550, not yet threatened, but these are the major statewide fires. A member of my cabinet, Dan Gibbs, the executive director of the Department of Natural Resources, is also a Type 2 wildland firefighter for well over a decade, and Saturday he was called up to fight the Cameron Peak Fire north of Estes Park. And I want to wish Director Gibbs well, and all of the men and women on the front lines of the multiple fires across our state, some of whom are professional firefighters, others of whom, like Dan, have day jobs, have responsibilities, at the call of the moment, dropped what they were doing, reported for duty as trained wildland firefighters for our surge capacity to address these fires. And on behalf of a grateful state of Colorado, I want to thank the men and women on the front lines, and of course their families, for supporting them and putting their own lives on the line, spending countless hours away from their families, risking smoke inhalation to protect our homes, our communities, in our state. So thank you to our firefighters. Back to coronavirus, and one more thing on fires. Many Coloradans are experiencing what may or may not be respiratory symptoms related to the poor air quality. And if you have a cough, sore throat, difficulty breathing, get a COVID test. In normal circumstances, pre-pandemic, you might have just written it off and said, oh, it's just the poor air quality. And you know what? 9 out of 10 times it probably is. But that 1 out of 10 times that it could very well be the deadly virus, you want to identify that early and prevent your friends and families and others from having exposure to what could cause them to be hospitalized or even lose them. So please, we have over 80 testing sites, covid19.colorado.gov. There's a new interactive map that launched last week there. Find one near you. If you're in the metro area, we have Waterworld in Federal Heights, several in Denver, Aurora. So if you are experiencing respiratory symptoms or cough, please get tested. So we have this system where we work on addressing extended transmission of the virus, working with our local partners. And just today I talked to the Adams County Commissioners, the Arapahoe County Commissioners. We applaud their strong public health response last Friday. And getting this virus under control really requires local and state partnership, and also, most importantly, your partnership, right? Counties and states can say what we say and counsel you how we counsel you, but ultimately it's up to you whether you take that scientific-based advice and follow that scientific-based advice. And I really urge you to do so for your loved ones, for your family, for our state, for our economy. Coloradans need to heed the wise counsel of our health experts in getting through this crisis, minimizing lost lives, and maximizing our ability to have a strong economic resiliency. And we welcome the support at the local level. Just an example of something that works. It's good to have a bright spot in these dark times. Boulder County, which was the site of a hotspot about 3 weeks ago with extensive increases in their rate, acted early through public health orders that put important safety provisions on their local businesses and individuals. They lowered the time for last call and conducted enforcement actions on mask wearing, and it worked. In just 3 weeks, they've gone from about 150 cases a day in Boulder County to 30 cases a day in Boulder County. So even as there is this surge of the virus in many parts of our state, including the Denver metropolitan area, which is our greatest concern, El Paso County, Mesa County, and others, we have seen the success of these measures in Boulder County, which has gone from hotspot to a much lower viral prevalence successfully over the last 3 or 4 weeks. And I know that Adams County, Arapahoe County, Denver, other counties that are taking these measures will also see the effectiveness of these measures in reducing the rate of growth of the virus in their area. This dial tool that looks at the situation of the virus in each county and helps empower city councils and commissioners for a local effective response is part of the framework to increase transparency and clarity and predictability for Coloradans. Gives real-time visual representation of each community's success and needs for improvement in battling COVID. Ultimately, it's up to each and every one of us, which is why the dial can be helpful as a consumer-facing visualization, so we know when we have to reduce our social contacts, as we now need to do, and be safer. The modeling data continues to be alarming if we don't make a change. I'm going to turn it over to Dr. Rachel Herlihy to discuss the latest updates with the actuals from the last few weeks and how that informs the likely choices ahead for Coloradans and what our future looks like. Dr. Herlihy.
Thank you, Governor. Good afternoon. As the Governor mentioned, we continue to see a rapid increase in COVID-19 cases and hospitalizations in Colorado. This is unfortunately the same trend that is occurring in many states across the country. This figure shows you daily case counts in Colorado in light pink and our 7-day average case numbers in dark pink. You can see that we have had 3 waves of illness, a spring wave, a July wave, and now a fall wave of illness. At this point, we are at our highest daily count since the beginning of the pandemic. Though keep in mind that because of much greater access to testing right now, we're really capturing many more cases. In the spring, with much less testing available, we estimated that about 10% of symptomatic and asymptomatic cases were being identified. Now we estimate that about 50% of cases are. We want everyone who needs a test to keep getting tested. We advise that if you have been exposed to COVID-19 but don't have symptoms, get tested at 7 days after exposure and quarantine for a full 14 days, regardless of the test result. If you have symptoms, get tested immediately. The next slide shows you our daily counts of new COVID-19 hospitalizations. Again, you can see the 3 waves of illness. Compared to the last figure with cases, where counts in the spring were limited by the availability of testing, here, with hospitalization data, you can see the clear, large wave of illness we experienced in the spring, a much smaller July wave, and our current fall wave. At this point, our hospital admission rate is the same as it was in May and is steadily increasing. One thing the public can do to help ensure hospital capacity isn't overrun is to get a flu shot. That'll help prevent flu-related hospitalizations, allowing hospitals to conserve resources. And it's best to get that done this month. This next figure shows you our week-over-week hospitalization trend. The weeks shown in blue are those where we have seen a week-over-week decrease in hospitalizations, and the weeks shown in red are weeks where we saw a week-over-week increase. The percentage listed shows you how much hospitalizations have increased or decreased compared to the previous week. What I've highlighted here for you is that in the last 3 weeks, we have seen hospital admissions growing at a faster and faster rate, or accelerating in the state. Next slide. That acceleration is consistent with the effective reproductive number, or R value, trend that we are seeing right now. This figure shows you daily hospitalizations in the black vertical bars, and then different fits of the model to our hospitalization data. Each of those model fits gives us a new estimate of the R value. When we fit the model in late September, the R value was 1.21. In early October, the value rose to 1.49, and most recently it was 1.51. This means that each person with COVID-19 in Colorado is infecting on average 1.51 other people. Our goal is always to try and have the R value be under 1. At this current high level of R, we expect hospitalizations to continue to grow at a faster and faster rate. As the governor mentioned, we're going to do a deeper dive on hospital capacity in the next week or so. But I wanted to start here and show you some of our hospitalization modeling data. So this model is showing us what we might expect over the next couple of weeks in Colorado. The black line shows you the count of hospitalizations that have occurred in Colorado by date, including our spring peak of around 900 hospitalizations. Based on our current trajectory, shown in the reddish or brown line, we are projected to exceed the level of hospitalizations we saw in the spring, in about mid-November. We are currently at a transmission control level of 66%. That means combined efforts of physical distancing, contact tracing, mask wearing, and other factors are decreasing transmission in the state by about 66%. To get back on track, we need to consistently decrease transmission to by about 75%. If we lose some of our transmission control, you see we increase faster and higher, as shown by the yellow line. But if we can increase transmission control, you see the increase is delayed and lower. But it isn't until we get to the most optimistic scenarios, reducing transmission by 75% or 80% in the next week or so, that we have the potential to avoid exceeding our spring wave. But we've done it before. We were at about 90% transmission reduction in the spring, but it's going to take a lot of effort to get there. This next slide focuses on our ICU capacity in the state and shows longer-term projections. The tan line on the left shows you ICU admissions in Colorado, including the spring wave. The diverging multicolored lines show you the different projected ICU admission counts that vary with different levels of transmission control. If we stay on our current path with 66% transmission control, shown in red, we stay just below the ICU capacity line, as shown by that dotted horizontal line. We have very little wiggle room there. If we can improve our transmission control in the next week or so, we can give our healthcare system much more of a cushion, avoid significant strain, and ensure that we can avoid use of alternate care sites and strategies. Next slide. However, the previous figure does not account for the decreased physical distancing that we have seen recently with holidays. We saw decreased physical distancing and increased disease transmission occur around the 4th of July and then again around Labor Day. This figure is similar to the last, showing ICU admission counts in the spring and currently, and then different projections based on different transmission levels. But this also includes the 10% or 20% decrease in transmission control that might occur if physical distancing decreases around the holidays. Those physical distancing decreases of 10% or 20% result in higher disease projections. Unfortunately, those holiday bumps on top of very high disease transmission levels result in our current level of 66% transmission control, shown in brown, exceeding our ICU capacity in late December. The story is better or worse depending on whether transmission increases or decreases between now and Thanksgiving, as shown in the tan, orange, red, and green lines. This last slide puts numbers to it and shows you the projected cases, ICU bed needs, and deaths that occur in the various scenarios. We unfortunately see the largest projected increases in deaths when ICU capacity is breached. If we can get our transmission control level to 75% soon, this table shows you that we can cut cases and deaths in half in the state. Now's the time to continue to follow public health guidance, and we need everyone to take an all of the above approach, because each action adds a layer of protection. Stay home when you are sick, wear a mask, physically distance, avoid gatherings, and wash your hands. The more we do, the more we protect ourselves, our families, and our community. Thank you. Back to the governor.
Thank you, Dr. Herlihy. And just to be clear, so people know, there is no cure for coronavirus at this time. There are slightly better therapies than there were in that first wave in April and May. But the net effect of those is that 70 or 80% of the people that wouldn't have made it in April still don't make it now. The net benefit from all of the new treatments you hear about might reduce fatalities about 20 to 30% from people who have coronavirus, maybe less. Some experimental ones maybe a little bit more. But net, it is just about as deadly as it was in that first wave. There have been relatively minor gains from therapies. That includes remdesivir, it includes steroids, it includes plasma, all of those things. They're wonderful. They're being used. They're being deployed in Colorado. But I think the best realistic case is they're reducing the fatality rate somewhere in that 20 to 30% range, and even that is not demonstrated. Given that, it's better to get it now than it was in March. It will be better to get it in January or February than it is now. Your odds are better over time. That's another reason to be safe now. There will be better treatments. We talked a lot about the vaccine last Friday. There are also many treatments. I don't think any of them could be categorized as cures. To me, a cure conveys something that really addresses the underlying health situation and cures it. But treatments that will show significant improvement in survivability are being developed as we speak. And just as there are some modest gains already, there will likely be additional gains by January or February on the therapeutical front, which would also have positive ramifications for hospital capacity as well, with shorter hospitalizations required as those become available. But there is no cure. It is still about as deadly as it was and has been, and we need to do a better job washing our hands frequently, wearing a mask, avoiding large groups, limiting social interactions to one other household at most, preferably just your own, and physically distancing from others. Now I'll turn it over to Jill Ryan to discuss this approach with local government using the dial to act early on regional issues on community transmission. Jill?
Thank you, Governor. Good afternoon. Since the beginning of the pandemic, local governments have really played a pivotal role in responding to the emergency, directly helping Coloradans day in and day out. After necessary and successful statewide restrictions to suppress viral transmission in the spring, we have implemented more sustainable policies tailored to local communities. Our newest framework is called the DIAL. It's a recognition that the level of viral transmission can look different in different areas. And therefore, containment measures also need to look different. So if you look at this slide, this shows the 2-week rate of disease transmission by county and the variation in that rate. You can see that cases are increasing in many areas of the state, indicated by orange and even red. At the beginning of this pandemic in March, when there was widespread community transmission, state policies were used to successfully suppress the virus. Next slide. Back then, the School of Public Health estimated there were approximately 4,500 new infections daily. State policies, a one-size-fits-all approach, are appropriate when there's widespread transmission. But being able to manage the pandemic on a county level provides a more tailored approach. And this slide shows the 3 waves that Dr. Herlihy was talking about, and certainly the large wave at the beginning in March and April. And then you can see over the 4th of July weekend, cases started to rise again, and we had success in bringing numbers back down by supporting local actions. We first did this in partnership with local communities through a variance process. But in September, acknowledging the need to provide counties with even more predictability, the DIAL framework was created. The DIAL reflects the incredible amount of diversity in Colorado. It recognizes that local conditions vary, that one part of the state may experience a large increase in cases while another area is stable. The DIAL gives us a way to treat different places differently. The DIAL provides a way to enable counties with lower contained virus to open further while keeping restrictions where we need them to prevent transmission. In this way, it right-sizes the level of openness with the local level of virus containment. The next slide shows the DIAL schematic. On the left side is protect our neighbors. This is the most open level of the DIAL. Because of this, it requires a county to meet 8 criteria that really demonstrate strong local support and partnerships with hospital, law enforcement, and other entities. To qualify for Protect Our Neighbors, a county not only needs to have low virus levels, it also needs stable hospitalizations, enough hospital capacity to handle 20% surge in admissions, a 2-week supply of PPE, the ability to test 15 people for 10,000 residents per day, a robust surge capacity plan for case investigation and contact tracing, as well as the ability to provide testing for close contacts. Next, there are 3 levels of safer at home. Level 1 is cautious, for counties with low virus levels that aren't quite ready for Protect Our Neighbors. Level 2 is concern, the baseline level for safer at home. And level 3 is high risk, for counties whose numbers are going up, but not to the point where everything needs to be shut down. On the right side is stay at home, where only critical businesses are open and people must stay home except for necessary activities. And we hope no county ever has to go there again. In terms of moving between the levels, each level is defined by 3 metrics: how much the virus is spreading, how many tests the county can conduct, and how many people are being hospitalized with COVID-19. Each county moves to a more or less open level, depending on how their numbers are looking over a 2-week period. But they do so in partnership with the state. If a county exceeds their numbers for a certain level, it's like a check engine light. If the light goes on, the county consults with the Colorado Department of Public Health and Environment on next steps. The first priority is whether any local strategies can be used to get cases back under control within a 2-week grace period. Boulder was a great example of this. They put in place aggressive local orders a few weeks ago and now have their numbers back down. Denver, Adams, and Arapahoe counties all announced local measures last week, limiting gathering sizes and other steps like increasing mask requirements or adjusting last call times. The hope is that local measures will be able to contain the virus. In some cases, counties will move to a more restrictive level. This only occurs after extensive state and local consultation. But at any point, if a county is able to sustain a reduction in cases, then they become eligible to move back down the DIAL. I want to conclude by thanking our local public health agencies. These professionals are really the heroes in this event, looking out for their communities first and foremost. Also, I want to thank local elected officials who've been tireless in their support of local efforts, and all the partnerships that went into creating the DIAL framework. We think that together this will provide a more sustainable path forward while also being nimble to an ever-changing response. Thank you.
Thank you, Jill. This is a very important tool to work with local officials on the best response. Now, remember that whatever a local government or state government does, it's only probably 20% of the equation. 80% is what you choose to do. That's a much bigger variable than whether restaurants close at 10 or 11 or not at all, or whether there's extra capacity or not. The biggest single factor that affects the spread of the virus is the choices you make. It's your behavior, it's my behavior, it's our behavior collectively. So we have known for some time we need to do a better job trying to improve and impact in a positive way people's attitudes and the public behavior. And that's why today we're announcing the launch of a significant campaign to do just that, called Step Up Colorado. And you might have seen the mask that I wore today. It's a Step Up Colorado mask. It means we all need to step up to wear masks around others. We all need to step up to avoid socializing with more than one other household at a time. to keep our distance. And I'm excited that we partnered with CDPHE using CARES Act money to launch a new statewide media campaign called Step Up Colorado. It's in English, and it's also Échale ganas in Español. This campaign emphasizes the importance of Coloradans wearing their masks, keeping their distance. And as Coloradans, we all know we need to do more. So that 80% behavioral factor of the choices people make, we need to do a better job. Not everybody is watching me talk, or if you are, hopefully you're heeding the words. Most Coloradans don't watch these quality presentations. I encourage them to do that, and they'll lead them to make the right choices. But others just see ads or flashes on social media, and that's who we know we need to do a better job reaching and impacting the behavior of. One of the most common reasons Coloradans reported for not keeping at least 6 feet of distance between themselves was that they didn't have symptoms of the virus like a cough or fever. But now everyone should know that it's common to spread the virus before developing symptoms, for the day or two before they're developed, or especially for people in their 20s, some whom are asymptomatic but also contagious. So this campaign will start on digital, social media today, expand into television, radio, retail over the next few weeks. Step Up Colorado will run statewide through December 30th. A lot of research went into this, research-based. It's a critical campaign, also involving community influencers throughout the state. We're tapping into many people across the state to really highlight a campaign in a public-facing way that moves the bar on the single most important factor in reducing the spread of coronavirus, and that is people's behavior, arming them with the tools, the data, the science they need. Showcases Colorado's full diversity in a Colorado for all. We know we need to reach everybody. So let's meet some of the voices. Let's see why people step up. We have a video here to show you, and then we'll continue.
I step up to protect my family.
I step up to make sure I'm there to watch my grandkids grow.
I step up so we can all get back to the things we love.
I step up because my community needs me to.
I step up to keep Colorado's economy moving forward.
Stepping up means wearing a mask
and keeping my distance when I'm around others.
Step up today. Wear your mask and keep your distance.
So, you know, for those who are watching this, thank you, and I know you're heeding the words of Dr. Herlihy and others, and you know a lot of the best practices around preventing the spread. Doesn't mean that you might not have been complacent at times. We all have, but you know the extreme importance now in the next few weeks. But for the much greater number of Coloradans not watching this, and probably not reading your articles, sorry, folks in the room, the much greater number of Coloradans who are not reading your articles or watching this, we need to reach them. That has the single biggest effect on containing this outbreak, and that's why this campaign is so important. And we invite you all to step up today, help us spread the word, encourage people to protect one another. Part of stepping up statewide also means stepping up economically, and that's our final announcement today. Is very exciting. It means supporting our Colorado farmers and ranchers who are working harder than ever since the pandemic with a disrupted and challenging food supply chain, statewide drought. I have our Ag Commissioner here, Kate Greenberg, who's doing a terrific job supporting the future of ag here in Colorado, to discuss make a new announcement today regarding the Department of Agriculture's efforts and share an exciting announcement. Commissioner Greenberg.
Thank you so much, Governor. Since the beginning of the pandemic, when the governor first designated food and agriculture as critical infrastructure, our teams have been working tirelessly to make sure that agriculture stays open for business, that we keep workers and customers healthy, and that we keep food on the shelves. And like so many people, farmers and ranchers have been hit hard by the pandemic. They've been navigating global supply chain disruptions and in many cases have had to overhaul their business plans overnight. This is on top of, as the governor mentioned, ongoing drought, poor prices, and other perennial challenges that agriculture faces. Yet people throughout agriculture continue to grow, harvest, pack, and move food all across the state to reach consumers in every corner of Colorado. Before I make our announcement, I want to highlight a few of the key items that we have been focusing on throughout the pandemic, and first say thank you to every single person who grows and raises food. Thank you. Just like our doctors and nurses and firefighters and teachers, farmers and ranchers have been stepping up for Colorado throughout COVID-19, and it's paramount that we continue stepping up for them. At the Colorado Department of Agriculture, we are here to serve agriculture, and that has remained our true north throughout COVID-19. We've been a steady voice for rural Colorado, working with state and local partners to make sure that ag stays open while keeping the public safe. We have been connecting producers and communities with federal resources and advocating for the needs of Colorado agriculture in DC. In addition, we've been supporting our 4-H and FFA youth all across the state. This year, we were able to hold a reimagined state fair, one of only a few states in the country able to do so, providing young people a safe way to showcase the hard work they've put in caring for and raising animals. We know that a strong recovery from COVID-19 depends on a strong and diverse agricultural economy. And at the Department of Agriculture, we have been building business for Colorado's farm and ranch families. We are promoting Colorado products to international buyers on virtual platforms, connecting consumers directly to producers via a brand new local food commerce site, coloradoproud.com, and working with partner agencies to keep farmers markets open. But of course, none of this work matters without helping ensure the health and safety of every single person in our agricultural community. Early on in the pandemic, we worked with CDPHE to create agricultural worker guidance to help protect critical workers. We supported farmers in creating a Promotora program that engages local leaders in public health efforts. We also know that mental health can be deeply impacted by the pandemic. And recognizing this, in May, we launched a new version of our rural mental health program, reaching families across the state in both Spanish and English to make sure everyone knows that there are free, confidential services available to them. And all of these services can be found at our website, colorado.gov/ag. Now is a moment to do all we can to continue stepping up for agriculture, to strengthen our agricultural economy and communities. Farmers and ranchers are often living on the margins, but we cannot afford to lose them. We have to focus on supporting our friends and neighbors across rural Colorado so they can ensure there is food on the shelves. In that vein, today I am delighted to announce that the governor has allocated $1 million of CARES Act funding to the Colorado Department of Agriculture to provide funds to Colorado farmers, ranchers, food hubs, and processors. This critical support from the governor will assist producers and processors in adjusting to the impacts of COVID-19. These funds will also help fill important gaps left out by federal aid, reaching producers of different scales, and investing in local and regional processing and food distribution networks, which is much needed. This is one of the many building blocks that we need to build greater resilience into our food system, to enhance food access, and to build jobs in agriculture. These grants will be administered by the independent Colorado Farm and Food Systems Respond and Rebuild Fund. Applications are open now and will be accepted through Monday, November 9th. So get your applications in as soon as possible. Visit our website, colorado.gov/ag, and apply today. And lastly, for all the consumers out there, you can also help today by buying directly from a farmer or rancher and getting acquainted with your local agricultural community. Check out coloradoproud.com, find a farm near you, and get connected with everyone who's growing our food. Governor, thank you for your continued support of Colorado agriculture and all the people who keep us fed.
Thank you, Commissioner. We love our Colorado Proud produce at home when we have it, and we love cooking for the kids and having some great Colorado produce. And thank you for your work on this. To apply, colorado.gov/ag. Applications close November 9th, so there's only a few weeks to apply. We want to push this money out right away to help our farmers and ranchers. So look, these numbers that we've shown you on coronavirus are not going to change magically on their own. The virus is the virus. It has not mutated in any way that affects deadliness or transmission. There's mutations that allow for traceability of certain strains, but it is the same virus. How it takes off in Colorado is simply a function of how we interact with one another socially. If we live the way we lived last January and February, this would be on an exponential curve. The good news is we're not that bad. We haven't lapsed back to pre-pandemic levels, but we also aren't doing well enough. We need to live like we lived in July, if you recall, over summer. We got by, and then too many Coloradans viewed coronavirus in the rearview mirror, and we need to get back to how we lived in July to be able to contain this and prevent it from overwhelming our hospitals and hurting our economy in local areas. Scientists are making progress. As we indicated last week, we're cautiously optimistic there'll be an emergency authorization for a vaccine as soon as late November or early December, with initial doses available in December and a larger number of vaccine doses available for the general public early next year. And I know it's not easy. I know that it's harder. I mean, we are bracing ourselves for what could very well be the largest national wave of coronavirus. National experts tell us that this is likely the largest wave right now forming. And we don't want Colorado to be a low-performing state during that wave. We want to exceed and do better than many of our neighboring states. We want to save more lives. We want to reopen our economy better and faster and safer. We want to be able to save jobs. We want to be a safe destination for people from across the country, and we want to contain the virus. And that depends on you and me and our behavior. It's where we're going to be working on doing better around the marketing and through social media and TV and radio. But ultimately, it's up to the choices that Coloradans make. Now, look, every Coloradan has made sacrifices. We all have. Most of all, those who made the ultimate sacrifice of losing a loved one to this pandemic. But that should really serve as a reason to strengthen our resolve, to be more disciplined about socializing less, not seeing more than one household, keeping 6 feet, washing our hands, wearing masks for the next few months as we get through this. There's more behind us than there is ahead of us in time. But we also need to make sure that there's more behind us instead of ahead of us in pain and suffering and loss. And that's the challenge that I give you today. We can do this. We will do this. Let's get through this together. Happy to take questions.
Hello, Governor. I'm Jesus Raquel from Noticias Univisión. Governor, in Spanish, siguen en aumento los casos positivos y las hospitalizaciones a causa del COVID-19. ¿Puede decirnos de qué manera va a controlar esta propagación del coronavirus en el estado?
Seguimos trabajando con los gobiernos locales para controlar el virus y que los brotes no afectan a otras partes del estado. Es más importante que siempre usar las tapabocas y tienen una distancia de 6 pies o más entre tú y otras personas en cualquier situación. Necesitamos tener mucha ocasión ahora mismo porque el virus todavía es muy presente en nuestro estado.
Mr. Governor, Charles Ashby from the Grand Junction Daily Sentinel. So here in Mesa County, I'm sure we're seeing the same thing. I'm sure you're seeing statewide. We've had 132 new cases in the last 4 days alone. And our health department director here says that much of that is caused by people meeting in small groups, being lax. People in the break room at work, people having people over playing poker or something like that at their house. Now, I know you've been doing a lot of these campaigns imploring people not to, to social distance and wear masks and stuff, but do you think we're at a point now, or first of all, I want to know if you're seeing that same trend statewide, and do you think we're at a point now where counties need to do what Boulder did and impose some sort of stricter gathering rules?
So what you indicated, small gatherings, does seem to be the largest cause of these statewide numbers, and that means, it doesn't mean, don't go dining outside for a restaurant for dinner, but it means go with just your household or one other household, right? The danger is 8 people, fine. If it's 8 individuals from 8 different households, that compounds the risk. If it's 2 families of 4, it's less, or best of all, if it's 1 household, enjoy your time out. This is the first wave in many ways for Mesa County. And this is new to Mesa County. Mesa County has been very fortunate, not that Mesa County hasn't experienced loss, but it has been disproportionately spared from the ravages of the virus. So now is the first wave, a very real wave in Mesa County, potentially a very deadly wave. And Mesa County residents really need to exercise the same kinds of precautions that we know have worked in other parts of the state to contain this outbreak before it becomes exponential and overwhelms Western Colorado's ability to provide care at the level we expect in our hospitals.
In the spring, when we had runaway transmission, we had statewide stay-at-home order, and the ski resort shut down, can you envision a scenario, given these numbers, that we'd have to do that again?
Well, you know, the strong public health response needs to be sustainable and needs to show how we can live our lives in a safe way. Ski resorts are a good example. The way that we used to experience a ski vacation with opera ski and the bars at night and the nightlife and packing in on gondolas with closed windows, that is not what skiing looks like in a pandemic. The ski guidelines were issued. People can ski, and we welcome people from across the country and when they're allowed to come here again from across the world. But we're doing it in a safer way. And that means both on the mountain, which is a minimal aspect of it. It's easier to do that in the outdoors on the mountain, but also off the mountain and how we provide a safe experience in towns that includes dining and other amenities. So it's really about figuring out how to live our lives in a safe way. Schools, another good example. Schools are back across our state. There's relatively few districts that aren't back at this point. And what does that mean? It means kids wearing masks. It means maximizing the social distancing, and it means locking down a cohort when there are cases of coronavirus and limiting the potential spread to that cohort. It's working, and we're learning, at least temporarily and for the medium term, how to live our lives in a reasonably safe way and a sustainable way.
This is Erica Melter from Chalkbeat. I sort of have 2 related questions. One, you just mentioned schools. A lot of schools have come back, but we are seeing a number of districts, especially in Adams County, either stay remote or move back remote. And so I'm hoping you can tell me your response to those decisions and what you think can be done to get those students back in the classroom. And then I also hope that you could expand on why you think that policy doesn't really work to change the trajectory of the virus, given what we saw in July after the mask mandate and the bar closure.
Policy works. It's about 20% of the equation. 80% is people's endurance, caution, compliance, following science-based guidelines about how to live their lives in a way that allow them to, of course, put food on the table and have the socialization that they need to get through this, but do it in a safer and different way. And that's why Coloradans really need to step up now. If you're going to socialize, do it with only one other household. Wear masks around others, indoors or outdoors, and wash your hands regularly. Yeah, most kids are back in school. I think there are some metro area districts that have delayed high schools, if I'm not mistaken, not necessarily elementary schools. I think that those are generally back, or some might be K-2, K-3. Across our state, the vast majority of districts are, of course, back full-time at all levels. But there are some districts in the metro area that are only partially back. And again, we've seen great success statewide with the health guidelines around our public schools. Now, it's important to define what success means. Success doesn't mean that no one gets coronavirus, whether kids are in school or not, whether teachers are in school or not. Some of them are going to get coronavirus at the local store, having dinner out from a friend. But what we mean by success at schools is outbreaks have been contained early and have not led to widespread outbreaks they've been addressed in a way. We've learned a lot about outbreak and site management. And so many of the school outbreaks, while it's difficult and many parents find it annoying to go online for 14 days and not have the in-classroom component, that has worked. And where we see cases, it's 3, it's 5, it's 8. If we operated a high school like we did last January, it would rapidly go from 1 to 36 to 152, to 200, just overnight. That has been prevented by these safety protocols. School is as safe as it's going to be during the pandemic. Sure, if the viral rates are a little lower, a little higher at different points in time, everything we do is a little bit more risky or less risky. School is no exception. But I am confident that we have been able to prevent major school-based outbreaks through these safety measures, and many districts have been through cohort closures and some even school-wide closures, and they've come back and they've done it in a safe way. Anything to add, Dr. Hurley?
Yeah, I would just add that transmission in schools is going to reflect community levels of transmission, and that's we expect to continue to see cases occurring in schools. As the governor mentioned, our goal is really to limit the amount of transmission that occurs in schools. We've been quite successful so far in keeping the outbreaks that are occurring in schools quite small. Cases in the numbers of 2 or 3 cases for these outbreaks, so quite small. I think there's differences. There's lots we're learning about transmission and how it happens in school and best practices to limit transmission, but certainly making progress. But as the governor said, we know that it's a reality that we are going to continue to see cases occur.
Review of where the state might have to move if cases continue to rise economically, or what steps you might take to limit people's movement or behavior? Like what extra steps are you looking at right now?
Well, so I would highlight again the effectiveness of Boulder County. 4 weeks ago, a hot spot, over 130 cases a day. Now 25 cases a day. Because of the actions that they took early on, they limited the activities of the group that had the highest percentage of positive cases. They worked with the city of Boulder, but they didn't even have to go countywide. Just the city of Boulder around bars and closure time and restricting mixing and nightlife, and that was effective. The biggest factor in this is people's behavior. It was tough for me to do a statewide mask order, but what convinced me to do it is that apparently there were Coloradans that were not wearing masks that would wear masks if the governor said so. It surprised me because I had been saying so for months, but they wanted me to formally say so. I guess they wanted a piece of paper. We saw that documented, so we found a 20% increase in mask wearing in jurisdictions that had a mask wearing requirement. So we did one. It's the interaction of law and psychology, and it's a new area for any governor. I think governors are more accustomed to operating in the political realm. This is more in the realm of psychology, where we used our very best ways of talking about it to encourage people to sustainably act in safe ways. Hence the new campaign today that we're launching, which has been weeks in preparation, but we're announcing it today. We knew we needed to do better explaining to the general public why these measures are important, what we can do better, and of course how policy can serve as an example, how policy can serve as a lead, how policy helps determine behavior, helps impact behavior, how confidence and transparency help improve behavior. But most of all, as a matter of individual responsibility, I know that Coloradans care a lot about their families, their loved ones, about their own lives, and that's why I'm confident that we'll do better.
Back then we were seeing the rising cases only in Boulder County. Now we're seeing in Denver and Arapahoe, Adams County. We're seeing in Pueblo County and Mesa County. So things have worked in Boulder County, such as limiting those gatherings to age-specific groups, and now Denver has expanded its mask orders. Would you be interested in following some of those steps on a statewide level if things continue to worsen?
So we have, as I said, we have counties that have decreased rather than increased, and we applaud their efforts. I think the best answer to your question, Jesse, is that there's different measures at different times in different places depending on the conditions. So if Charles is still on the line, Mesa County was the very first in the state to open restaurants for in-room dining for a lot because they had very low viral prevalence. They're really facing what is for them their first wave. First significant waves. They always had the virus there, but this is their first major wave, potentially like what other areas have faced. Other areas have very low viral presence in our state. Some of our other rural areas. Other rural areas have high viral presence, Yuma and Logan County. So, you know, it's acting to contain the virus where it is at a moment in time, not where it was. We never can anticipate where it will be, but it's the right response at the right time in the right area to contain the spread of the virus.
Yeah, hi, Governor. Mary Ann Goodland with Colorado Politics. This question may be for Dr. Herlihy more than anyone else. We've got these 4 counties with the 2-week incidence rate that has gone up fairly substantially. How much time do they have to turn this around? Is it 2 weeks or is it more than that?
Thank you for the question. This is Director Jill Ryan, and I will answer that. So for the counties that have had increasing rates, we've asked them for their mitigation plan. We received many of those last week. We told them we would check in 10 days and see if we've been able to see a plateau or the start of the decrease in the virus. And then we will make a decision at that time whether we give them more time or move them on the dial.
And just this morning, I talked to and thanked and expressed gratitude for the work of the Arapahoe County and Adams County commissioners. Jill joined me as well, who are thoughtfully targeting a local approach, recognizing the increased level of danger in many of our suburban communities and urban communities. Thank you all for joining us. The challenge is let's do better. Let's step up. Let's step up, Colorado. I know that we can do this together. Be smart. Wear a mask. Make sure your loved ones wear masks. Avoid social interactions except when absolutely necessary. If you are going to socialize, do so with just one other household. Wash your hands regularly, and we'll get through this. Thank you.